Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nipple Talk. We got some good segments today. First off, this one is absolutely crazy. A man accidentally dies from a surgeon taking out his liver when they were supposed to take out his spleen. It's crazy. We're going to break it down. And then, Real Housewives of Orange County, Tamara judge, unrecognizable after plastic surgery? What did she have done? We're going to talk about it. And then finally, Sarah's going to tell us all the health benefits of fiber, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nipple Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nipple Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. Turn on those notifications so you can see our videos whenever they pop up. I'm your host, plastic surgeon Dr. Bruce Hermann. With me is the wonderful Sarah.
Hi.
Hi, wonderful Sarah. In the box is awesome Travis. What's up, Travis?
Hello, how are you?
Good, man. You guys having a good week?
Yeah.
Had
Yeah?
a pretty good week.
It's always good. Fridays are always good. I'm always happy on Friday.
I feel like it went by faster
It
than
does,
usual.
yeah. This week did go by pretty quick. Yeah.
I'm like,
busy
was it
week.
Labor Day week? Was it?
Wait,
'cause
was
of
Monday Labor Day?
It
Yeah, it
was.
was Labor Day.
That's-
That's why it went by so
that's
fast.
why.
Yeah.
It was a short week.
I forgot about that. I actually took, Labor Day was the first day I had off since I was on vacation like a month ago.
Oh, really?
Like I wasn't on call and I didn't have to go into any hospitals. I literally took the entire day off,
Good.
which was nice. It was cool. We didn't do a whole lot. We had family in town, just hung out.
Do you make food? Don't you like to grill and
I
stuff?
do. Yeah, what did I make this week? I made some really good pan-seared scallops with a balsamic reduction, which were really, really good.
It sounds very fancy.
Yes,
Yeah.
chef.
I love making stuff like that. I usually will go to, we have a really, really good Kroger by my house. It's like Kroger,
Marketplace.
maybe, or Signature Market. I don't
Yeah,
know.
the fancy ones.
It's super fancy. And I like to go to it's not the butcher, but the deli. No, not the deli. Where they have the meat.
Yeah.
Butcher, I guess.
Yeah.
I don't know. Is there a name for that? I thought it had a fancy name. Anyway, so I go and I check out what they have because they get all kinds. They get Wagyu steaks in there, and they
Yeah.
have all kinds of fresh seafood, and they had these really huge scallops. And so I'm not gonna lie, a lot of times when I'm thinking about how to cook stuff, I literally will jump on ChatGPT or Grok, and I'll be like, I got some boom and scallops. Give me 10 recipes for scallops. And then
I've used ChatGPT to figure out how to cook things.
Dude, it's great.
and-
I mean, honestly, that's one of my favorite uses for AI because it will come up with some really, there was 3 or 4 recipes for scallops, and I was like, man, these all sound good. And it
Combine
kind of.
them? Did you combine these 4 recipes?
No, I just did one. I mean, I don't want to make it too crazy, so I
Take
found
the
one that
best.
was a balsamic reduction, and I've used balsamic reductions before, but it'd been a while, and this one had kind of a, it was balsamic vinegar and honey and butter.
Yeah.
And then you heat it up to reduce it, and it was super good.
Yeah, you know that you can put your favorite recipes, maybe your favorite recipe to cook is really unhealthy. You can put that into ChatGPT and be like, hey,
Make this healthy.
make this healthy, and it'll tell you all
How
the
do
ways
I make
to
this
make it
double
healthier.
cheeseburger fried in butter healthy?
Yeah, it will.
But no,
That's pretty cool.
I love cooking. I honestly I'm pretty busy, so I don't have time to cook. But I really enjoy it when I have time to, and I like just trying new things. I'll just spring something on my family.
Mm-hmm.
It's I've never made this before, but I'm gonna try it. And then if it's really really good, then we do little parties and wine clubs and stuff, and I'll make food for it. They think everyone not everyone. A lot of people at the wine club think I'm a really good cook, and I don't really think of myself as a good cook. It's just I just will not afraid to just try something new. And if you can follow a recipe, I mean, generally things turn out pretty good, right?
That's how I think of it.
Yeah,
too.
exactly. So anyway, but yeah, so I did cook a little bit.
Nice.
There we go.
Yeah, that was fun. Did you guys do anything on Labor Day or just chill out?
I went and paddleboarded with one of my friends.
Oh, you did?
Yeah.
On which lake?
Lake Louisville.
You went paddleboarding on Lake
Somebody
Louisville?
died there, too.
Yeah, people die there all the time.
Again, but over the weekend.
Dude, getting on
3
Lake
people
Louisville
or
on a
something.
paddleboard that's that's the next level, man. Like, it's dangerous out there.
No, it wasn't. It was fine.
Where'd you go? By?
It was like by the lake beach, like where the little
Okay.
volleyball courts are and stuff.
I get to see you out there, like, paddleboarding across the middle of the lake with, like, all those, like, drunken speedboats, like, going everywhere.
There were some, what are those things that look like
Sea-Doos or jet skis?
jet skis that were kind of being weirdos and making all the, like,
Yeah.
waving
So-
all stuff, but it wasn't that big of a deal.
I actually grew up right next to Lake Louisville, and when I was a kid, I worked all the time, so I saved up money. I actually bought two, like, old, like, 15-year-old jet skis, and man, I was on Lake Louisville all the time.
Yeah.
It was so much fun, but that lake's like, it's sketchy. Like the water's sketchy, the people are sketchy. I mean, I hate to dog it. It's my hometown lake, but still.
Yeah.
But that's impressive. I've never paddleboarded. Is it fun?
Yeah. I mean, I just go out there and bring like a couple little seltzers and like a little cooler and just kind of, I usually don't stand up. I usually
really?
just like sit Indian style
Oh,
and just,
okay.
yeah.
I thought you had to stand up. No?
No, I mean, you can for sure. I think that's like how it's normally done.
It sounds like it's more work that way.
It's harder for sure. You
Have
fall
you ever
off more.
paddleboarded, Travis?
Never. A day in my life, I can't swim, so I don't like big.
You
bodies.
can't swim?
Yeah,
Cannot
you
swim.
you
I
forgot.
think we talked about this one time.
I
big
would
bodies
do
of water.
not. I
Yeah.
do not forget that. I will not.
I forgot about that.
When I learn how to swim, I hope you remember that too.
I will. I'll
Alright,
celebrate
for sure.
it. I'll
Yeah,
celebrate
dude.
it.
Alright, for sure.
All right, well, I guess let's jump into some segments here. So we're always talking about crazy segments, and this one, this may be the craziest segment as far as like just like what something happened that's just totally unbelievable.
Yeah, this is a weird one.
Yeah, and so you guys may or may not have heard about this because it's really kind of been popping up on social media a lot. So this is a story about a man who died during surgery when the surgeon accidentally removed his liver. And
In America.
this is in America, and it was in Florida. Yeah.
Oh my gosh.
So I can actually talk a lot about this because this story, I think, to the layperson, I mean, that sounds crazy, right? If I told you that somebody went in for surgery to get their spleen out and actually took out their liver, like that sounds shocking, right?
Yes.
Yeah. So I can shed a little bit of light on this, but like there's really no there's no good ending to this. So the background on this is a 70-year-old gentleman named William Bryan, who actually is from Alabama and had some rental property in Florida. So he's down in Florida and he started having left flank pain. So basically pain on the left side, more towards the side and the back, all right? So he goes into the hospital and they do some scans on him and they said that he had a spleen abnormality. Now, I didn't say specifically what that was. It just said spleen abnormality. And they recommended he have a spleen out. Well, there's certain things that can go wrong with spleen. Like it can get lacerated pretty easy because it's kind of a big spongy organ. It can have like cysts or masses or whatever. So all that sounds, fairly,
Fun.
So far, it's pretty reasonable. So he didn't want to get treated. He wanted to go home. And apparently, this is according to the lawyers of the family, that the hospital coerced him into having surgery. So there's a Dr. Thomas Shaknovsky. I looked this guy up. He's a board-certified general surgeon. So, okay, so far so good. We always talk about these weird stories.
But then he's really a plastic surgeon doing, just kidding.
Yeah, right. No, but this guy's a
Removing
general
organs.
surgeon. He's the right type of surgeon for the job, which I was a general surgeon before I was plastics.
Okay.
So far I'm like on board with this. So he took him to the OR for a laparoscopic splenectomy. So basically laparoscopic splenectomy, it's using the little camera, you make the tiny little incisions and you dissect out the spleen, and at the very end you kind of put your hand in there and scoop it out, right? So this is allegedly what happened from the actual op report, which is crazy about this story is the op report. So when I do a surgery, I have to dictate what I did, like what happened. So like the patient, the diagnosis before and after the procedure, was there complications, blood loss, the indications for the procedure, and then the description, right? It's called an op report.
Yep.
So the op report is out on the internet, which I assume that the family got it because they can get it because it's medical records, and then they released it. So the op report's out on the internet. So I'm reading the op report, and this is allegedly what happened per the op report. And I got this from what the actual surgeon wrote. So a surgeon started the procedure laparoscopically. He located the spleen. He noted that the spleen was very large, so he converted to open, meaning, all right, that happens sometimes you're doing laparoscopic surgery. You get in there, it's just too challenging, and you have to actually open the patient up because it's always easier to do these things when they're open. So he opened them up. He says he dissected the spleen free to the hilum. So the hilum basically is like where the blood vessels like come into the spleen, right? So here's your spleen, and it's got blood vessels come to it. So the hilum's right there. And when you're doing a splenectomy, which I did a ton of them when I used to do trauma surgery because people are always getting their spleens banged up, you basically grab the spleen, you pull it up, you see the blood vessels, you put a clamp across it, you cut them, spleen's out, you tie it. Like, I mean, I could do like an emergent splenectomy in probably 5 minutes. Still, this day, they're like not complicated, okay?
Yeah.
Now, that's in a patient that, you know, it can be complicated if a patient maybe has had 15 abdominal surgeries in the past.
Okay.
But standard splenectomy, pretty easy. So he located the spleen, he pulled it up. He noted that there was an aneurysm on the blood vessels. And so he went to ligate the splenic vessels, and suddenly massive bleeding occurred, which is weird because the spleen vessels are not small, but they're not that big either.
Okay.
Like, the spleen will bleed if you rupture it in a car crash, but like compared to other blood vessels, splenic vessels are not huge. So he says a splenic artery aneurysm ruptured. So an aneurysm is when the artery dilates and it gets too large, and then those are at risk for bleeding. If you've heard of like brain aneurysms or abdominal aneurysms, like that's kind of a dangerous thing.
Right.
So apparently, according to the op report, it ruptured. Patient went into cardiac arrest. They started, massive blood transfusion protocols, but they couldn't save him, and patient expired. And so it did say that the spleen was eventually removed and sent off for pathologic evaluation. So that's from the op report. So the pathology report comes back, and the pathology is that it's not a spleen, it's the liver.
Oh my gosh. So he didn't even touch the spleen.
Correct. On the autopsy report, the patient's spleen was still in the patient, the liver was missing, and it was noted the patient had a splenic cyst, which was probably the source for his pain. So this brings up a ton of questions, which I'm hoping to maybe shed some light on. So I guess the first question that if I was a layperson that you might ask is it possible to confuse the liver and the spleen? And so, sort of.
The liver is like so much bigger.
Correct, absolutely correct. So I want to like show you a couple pictures here. So the first one is the anatomy. Okay, so this is obviously a cartoon drawing. The big thing at the top is the liver. It's got the left lobe and the right lobe, and you see the spleen. It's kind of right underneath the left lobe of the liver, which would be basically underneath your diaphragm on the left side of your body, okay? And so you can see that the left lobe of the liver and the spleen are very close to each other.
Yeah.
So anatomically, it could be conceivable that you could, confuse these, because although it's always said that the liver's on the right side of the body. That's not entirely true. It kind of crosses the midline with the left lobe. What about the appearance? So let's look at the next picture, which is the appearance of these organs. So the organ on the left is a liver.
Yeah.
The organ on the right is a spleen. They do look similar, okay? It's not like a stomach and a liver, which the stomach looks completely different. These organs do look similar, okay?
Yeah.
They look a little bit, they're different, but they look similar. So
but to like a normal person, they look similar, but they shouldn't look similar to a surgeon.
100% correct, Sarah. 100% correct. Now, does being laparoscopic make it more challenging to identify stuff? Yes, it does. When you're looking through a laparoscopic camera, you're looking almost like through a keyhole into a room. So throw up that picture, the next one, Travis. So this is basically a shot from a laparoscopic camera, and you can see, well, I mean, it may be hard for you to identify it. The spleen is that kind of big spongy thing on the right, and you see in the background, there's the liver. They do look similar, especially if a patient's had previous surgeries, maybe there's like some scar tissue in there. It can be challenging to get exposure with laparoscopic surgery. I've always found laparoscopic surgery to, be more challenging than open. If you open something up, everything's pretty clear pretty quick. So the problem is, according to this op report, is the surgeon says that the spleen was big, and then he opened, and then he did all this work to remove the spleen. None of that makes sense. like I can buy that a surgeon got lost in the laparoscopic view. In fact, I have a story from my residency. When I was a resident, a 5th-year chief resident and a laparoscopic fellow went in to do a spleen, and they actually took out a kidney.
Uh-oh.
Like, it can happen. Now, that's completely careless. Like, there's no excuse for that. But I wasn't involved with it, but it happened at the place where I trained. Like, it can happen that you can get lost laparoscopically, see something, and because it's a darker view, it's not as clear, like you can mistake one organ for another. Once you open, that no longer applies.
Right.
Like, any surgeon of basically any training level can identify a liver and can identify a spleen. So this op report where it says that he's dissecting out the spleen and he sees a splenic artery aneurysm, like, in my opinion, like, this is total fabrication. Like, I don't think that you can believe anything in that op report. Because at the end of the day, if you're gonna believe that op report, you have to believe that a board certified general surgeon can't tell the difference between the spleen in the liver inside the body, which is just inconceivable to me as a surgeon.
Yeah, I bet they're gonna be investigating all of the
100%.
techs that were helping him.
So I have a theory about what happened. And of course, this is just a theory based on what was said by the lawyers of the family, what's said in the op report, you know, what the pathology says. Because once, didn't mention this, in the pathology, it wasn't like they took out like a portion of the liver. Like, it was the whole liver. You can tell by the weight. You know, like, so for example, you were talking about size. You're right, the liver is much bigger than the spleen. An average liver might weigh 2,000 grams, right? So that's like, what, 4.4 pounds. The average spleen weighs about 150 to 200 grams. So it's like a tenth of the size.
So he took out the entire liver.
He took out
not like just a portion.
Correct.
Because like I could see maybe like him making a mistake of taking out like the smaller
lobe.
left lobe.
Right. And that was one of
But he
my
took out
thoughts.
the whole
Before I
thing?
saw the pathology report, I was like, my initial theory was that he took out the left lobe of the liver, which that would be challenging because the lobes of the liver don't easily come apart. But hey, I mean, you know, things can happen, or maybe it's unusual. But my theory is, this is my theory on what happened, and I'm not sure that there's a better theory out there because a lot of people have been talking about this on social media. So I think that the surgeon started the procedure laparoscopically. I think he confused the left lobe of the liver for the spleen, exactly what you said. I think he started to dissect down to what he thought was the hilum of the spleen, which ended up being the hilum of the liver. And when he started dissecting out, it's a much, much, much more complex blood vessel system. In fact, I have a picture. Throw that picture up there, Travis. It doesn't have the pictures of the splenic vessels, but these are the blood vessels at the base. See that huge mass of blood vessels at the base of the liver?
Yeah.
You got like the iliac vein running through there, the portal vein, which comes from the intestines. I mean, it is just a, you know, Gordian knot of blood vessels. It's a very, very dangerous place to be. I mean, I know that from, you know, when I've done liver surgeries back in my general surgery day. It is a super dangerous place to be. And if like you blaze in there thinking that it's just like one artery and one vein, it would be very easy to get into massive, massive bleeding. So my theory is the op report's a fabrication. He sees the left lobe of the liver. He thinks it's the spleen. He starts dissecting down. He gets into massive bleeding, and then he opens. Like, I don't think the bleeding happened when it was open. I think that it happened when it was laparoscopic. But at that point, like, it was too late. Like, he couldn't get exposure. Like, those blood vessels, I mean, you can exsanguinate through those blood vessels in minutes. Like, those are massive, massive blood vessels. So I think what happened is he got into trouble laparoscopically. He converted to open, but couldn't salvage it. And I think the guy might have panicked and just, like, how do I get out of this?
Right.
And so, you know, with all that bleeding, I could see the liver gets dissected, you know, free even more. And, you know, he's got this story of, you know, oh, the spleen's bleeding because he thought it was a spleen. And I guess he just took out the liver to try to pass it off as a spleen. The only crazy part about that, well, I mean,
Take it
he
into
told the
science
family,
to
according
see.
to the lawyers, he told the family that the spleen was, the patient had splenomegaly, which is a condition where the spleen enlarges due to basically functional problems. And you can get some massive spleens. I mean, you can. And so my theory is that maybe he pulled out the liver and tried to pass it off as a spleen, because you know, if I pulled out a liver and showed it to the average person and said, this is a massive spleen, I mean, they probably wouldn't know any better.
Right.
I mean, you guys probably didn't know what these things really look like until we just looked at the pictures like
True enough.
10 minutes ago. But the only catch to that story is when it got sent to pathology, the pathologist would know it was not a spleen.
Yeah.
But I have a theory about that maybe he told them that he didn't want to send it off as a specimen, because when you take something out of the body, you're not obligated to send it to pathology. You know, I take out stuff out of people's bodies all the time, and every time I take something out, the nurse will be like, do you want to send this?
Yeah.
And if it's important, I will. But for a lot of stuff, I don't, because why would I want to generate more bills for an answer I already know the answer to, right? And so maybe he told the OR, like, don't send it. It's just a spleen. We don't need to send it. But then because the patient died, maybe they send it anyway.
Yes, that's what I would think.
Because the only two explanations to this is either you have a general surgeon that absolutely confused the liver and the spleen, which is inconceivable. I mean, it's like, Trey, if I said that you didn't know the difference between a microphone and a camera, like in your business, right? I mean, nobody could believe that.
Yeah.
No one could believe that. So either you have a surgeon that can't identify these two structures, or there's a cover-up. There has. I mean, that's the only two explanations.
He's a, what are they called? That people that take organs from people?
Like organ harvesters?
Yeah. He's trying to take his liver and sell it off.
Yeah, I don't know.
It's Florida. Anything goes.
I mean, but this is like a reputable surgeon. I mean, the guy, well, I will say, so digging into the surgeon's background, I mean, and I didn't personally dig in, it was in the article I was reading. And apparently he got into a little trouble in the past when he was supposed to take out an adrenal gland and he took out part of the pancreas. Now, to be fair, those are structures that are right next to each other, and maybe he got the adrenal gland.
But everything's right next to each other inside of your body.
Yeah, you're right. I mean, you really shouldn't do that. But like, once again, it's like conceivable. Like, that's much more conceivable than I took out a liver when I thought I was taking out a spleen.
Yeah.
You know, because I mean, it happens. Sometimes stuff sticks together. It won't dissect free, and it's like you got the adrenal gland. But I think at least according to the news article, that he actually didn't get the adrenal gland and he only got pancreas, which that would be really bad because that means you're not really knowing where you're at in there. So, but yeah, I think based on the information that we know from the op report and from the report of the family, the report of the lawyers, there's only two explanations here. Either this is literally the worst surgeon in the entire world, like of any country, or there was a cover-up of some sort that tried to go down and it didn't work.
Yeah.
As an organ harvester.
I don't think he was an organ harvester. I don't think so. So, yeah, crazy story. So what's going to happen to this guy? I mean, that's a big question, because now there's questions of like, is there going to be criminal, charges against this guy? He's already getting sued by the family, which this is a slam dunk case for the prosecution.
Is he going to do you get your license taken away for that? I would think so.
I think so. I mean, obviously, I'm not going to speak for any medical board, but like unless there's something we're totally missing, those two options I talked about, like he doesn't know the liver from the spleen or he tried to cover it up, like both of those are, in my opinion, not conceivable with continuing to practice.
Yeah.
I think. I mean, I don't know what the medical board's going to do.
Like I wouldn't want him to do a surgery on me ever.
It's crazy.
No,
and then I guess as far as like criminal, I mean, I think it's rare that you see doctors get charged criminally unless there's just like gross negligence. Like remember the doctor, the plastic surgeon that the patient arrested didn't call 911? Okay.
Yeah.
That's obviously.
It's like maybe like what if he has like some type of like chronic disability that's happening to him, making him not able to practice efficiently, and then he's still doing surgery knowing that he has that. That would be criminal. That
could be, or if there's like substance involved.
Yeah.
I mean, it may be criminal.
But if it was just purely just like
a mistake,
like a huge mistake, then I don't think he should go to jail.
Yeah, I don't know. I don't know enough to say.
He should not be able to practice.
I think that there is that potential risk that this could become a criminal case. But of course, who knows? This is definitely a story that we're going to have to follow up on, because I think more information will come out. Because what's going to end up happening is people from the OR are probably going to get subpoenaed, and then you're going to get more information of what really happened. Because, like I said, I don't believe that op report. Like that op report's a fabrication.
Yeah.
Like nothing about the op report makes sense to me.
Yeah.
I mean, it makes sense if like everything went fine, right? If actually they sent the spleen, but obviously they sent the liver. So wild stuff, man. It's definitely one of the craziest stories that I've seen. So, all right, let me just recap this one real quick. So today we're talking about the unbelievable story of a man who died in surgery when the surgeon accidentally removed the liver when he was supposed to remove the spleen. This story is absolutely one of the craziest I have ever heard. Is it possible for a surgeon to misidentify the liver for the spleen? It is if the surgery is done laparoscopically. I could conceivably believe that could happen, but according to this op report and according to the lawyers for the family, this surgeon opened the patient up, which at that point, it would be inconceivable that a surgeon could remove a liver thinking that it was the spleen. So there's something that we don't know here. Either the report from the OR is completely wrong or there was some sort of cover-up going on, but this story is unbelievable. If you want to see more details about it, check out our full segment on YouTube. We kind of dive in and talk about what might have gone on here. So crazy stuff.
Right on.
Very.
Yeah, I mean, it's a sad story. Obviously, somebody died, and it sounds like, that he absolutely shouldn't have died. Like this should not have happened to this guy at all. Because sometimes, people, if somebody comes in with multiple gunshots and you can't save them, you're like, oh, well, you did everything you could, and you did the right thing. This is not one of those cases.
Yeah.
Yeah, no, wild stuff. All right, moving on. Is Real Housewives still on? Is that show still around?
Yes.
Oh, it
I
is.
think it's a bunch of them. Like, I think
Okay.
it's
Well, I knew there was a bunch of them, but I didn't
Yeah.
know if it was still actually on air. Well, we got a Real Housewives story here. We've talked a lot about the Real Housewives over the years. Like, remember we had Tiffany Moon, she's Real Housewives of Dallas.
We did.
So this is Real Housewives of OC. I have to admit, I actually watched Real Housewives of OC back in the day, talking like,
The only time I ever watched Real Housewives is when they filmed it in North Texas, and
oh,
one of the
with Tiffany Moon.
No, I think it was even before that.
Oh yeah, because she came on like season 3 or something. Yeah. So this is Real Housewives of Orange County, and it's about Tamara Judge, and Tamara Judge has been blowing up on social media lately because she has been called unrecognizable after recent plastic surgery. And I always liked Tamara when I remember her from the show. I always liked her character. She, or not character, but her as a person. She was kind of, I thought, one of the cooler ones. So she's currently 57 years old. She did rise to popularity in 2008 when she joined the cast of The Real Housewives of Orange County. And she's no stranger to plastic surgery. She's actually been very open about the procedures and the surgeries she's done. And I kind of recapped, like she's done, of course, Botox, fillers, skin treatment. She had a breast augmentation. I think she may have had a revision at one point. Then she had an implant removal, which they probably did a lift. She had abdominoplasty or a tummy tuck. She had a facelift. So this girl like knows her way around the plastic surgery office, okay? No offense,
Yeah.
I'm just saying, she's
She's a good customer.
She's been very open about it, which I think is super cool. I think that's great when people talk about, how does this lady look so young when she's, 50 years old. So she was recently in the news this past week because she was posting on social media about her recent foray into plastic surgery. So I got some videos. Let's roll that very first video that she posted. Travis.
Dr. Donnie Maltz out of Newport Beach, who works with Dr. Ambe, and he performed a brow lift.
Okay guys, I made it. I am 1 hour in recovery. I don't feel bad. My eyes are all blurry because there's like, I don't know, something like Vaseline in there or something. But let the healing begin.
He also did a CO2 laser with a blue peel.
All right, I got home from the surgery center about an hour ago, so this is probably 3 hours post-op.
That video, that's like right after she had the procedure. So Sarah's like, why is she blue? So that's that blue chemical peel. That's I'm not even familiar with which one it is, but like some of those peels contain.
Oh, she looked green.
Yeah, she looks green.
On this side.
So that's not even why she was like getting blown up. It's how she looked in the videos we're about to watch. Because after she started posting the next few days, she just got like roasted. She was like called unrecognizable. Her mom even said, this is her mom, "Your face literally makes me want to throw up. My friends are asking if you've been in a motorcycle crash." I have to agree, she looks
Why
pretty...
would
she does look pretty rough.
her mom said that publicly?
Well, I think she texted her that, and then she posted that to social media.
Oh, the Real Housewives
Sheesh.
person that got all this stuff done?
Yeah, Tamara. Yeah,
Oh.
Tamara Judge. Yeah. All right, so roll the next video. We're starting to see some of this. This is hold on. This is day 2. She says it's day 3, but she made a mistake. She corrects it later, but this is day 2. Go ahead.
Hey guys, just wanted to get on here and give you an update. For some reason, I thought yesterday was day 3, and it's actually today is day 3. So this is the thick of it right here. This is the worst day of it all.
That actually may have been was that the 3rd video, Travis? Was there one in between those 2? Or no? I may have misuploaded them.
Let me see. We can play this one.
Okay guys, this is day 3. It's supposed to be the worst of it when it comes to swelling. The swelling is from the CO2 laser. You can see it's all the way down my chest. But you can imagine what it feels like. Hi guys, it's the end of day 3. Swelling is supposed to be at its worst right now. I don't know how it can get any worse. I feel like my skin's gonna burst. You can see it's getting oozy. I can barely open my eyes.
Dude, she's looking rough there. Like, that's pretty.
I saw that's funny because I saw a TikTok or reel about a woman that did a facelift too.
Uh-huh.
And she looked like she just like somebody just like beat the crap out of her face, and then like it was like, oh, and then 3 months later she looks like a freaking like model. Yeah. And she's in her 50s. Mm-hmm. And I'm like, damn.
Mm-hmm. Yeah, facelift can go a long way. I mean,
but it looks like it is like torture.
Yeah, her face, like that girl Tamara's face looks so swollen. Like you can just see her skin. It's almost just like it's like blistering and peeling. All right, go to that. I think is there one more video or 2 more? Yeah, one more. Yeah.
Doctors today, trying to stay positive. I know there's a lot going on right now. Gotta just remove myself from it. Neck is actually the one, it's the most painful right now. It's not coming off as quickly. I don't know if it's because the skin is thinner there or thicker there or what it is, but it's very sore.
So that was what she posted. I don't know if it was yesterday or the night before. That's very recent. 'Cause she's been like kind of, documenting her journey here. So as she said, she had a brow lift, a CO2 laser, and a blue chemical peel. So the CO2 laser is what's making her look like that. Brow lift will give you some swelling for sure, but that CO2 laser basically just cooks your skin. And I'll tell you, like, I do like CO2 lasers. I don't have one myself. I have the Halo Cyton, which I love, love, love. And so the way to think about these lasers is they're both very similar. So those lasers ablate the skin, so basically strip off the top layers, but then they also penetrate the skin to cause skin tightening. And they're different lasers, like the one I have versus like the CO2 laser, but the CO2 laser is like the super heavy duty version. Yeah. And it's the reason I haven't bought one yet, because like with the laser I have, you get 4 or 5 days of being swollen and like red.
Yeah, it looks like her face is being melted off.
Yeah, totally. And that's what a CO2 laser does. Like it just like causes
Sarah seems so alarmed and disgusted at the same time.
I know. It's like a Raiders of the Ark kind of so I mean,
who did this to you?
I like a CO2 laser, man, because they do some incredible work. Like the laser I use does really, really good work, but the CO2 laser does even more.
It's like more gentle.
Yeah, the one I have is more gentle. But the thing about the CO2 is, like, she's gonna have weeks of recovery. Like her face is gonna look not normal for like a minimum of 2 weeks up to 6 weeks, depending on exactly which laser and how powerful, like the setting they put it on. And I just have personally found that, there's not a ton of people that
are willing to do that.
That were willing to do that. And the thing about the CO2 laser is, I don't know if it's the same for every state, but in the state of Texas, like it can't be done by anyone but a doctor. And so like the laser we have at the office, at my office, I mean, it's actually run by like most of my estheticians, because it's not as dangerous. CO2 laser can harm you. It has the potential to do real harm. But yeah, it's basically the laser that's doing that. It's actually not even surgery. Like the titles that you're seeing on social media is, unrecognizable plastic surgery. It's really the laser that's doing that. It's a CO2 laser.
The only real like plastic surgery she had was the
it's a brow. She did a brow lift. Yeah, which I'm not a huge fan of brow lifts. Like brow lifts used to be really popular like prior to Botox kind of exploding. So brow lift basically is where you make incisions up here and you pull the brow up, like you're lifting your brow. And the major reason that people did that is they would age, get age wrinkles on their forehead and to make them look old, and so you do a brow lift to get rid of them. Well, when Botox came out, like people stopped getting frown lines, you know? And so, you know, nowadays, I think on average, there's about 10,000 brow lifts done a year in the United States, which is really low. You compare that to like facelift, neck lift, which is like over 100,000. So like 10,000 is pretty low compared to breast dogs, which is like 300,000.
Yeah.
I mean, there's not that many brow lifts done anymore. I'm not a huge fan of them because they do have some complications, and so
they're just not as necessary.
They're not as necessary. I mean, I'm not like, dogging people that do them. I just personally wouldn't do one because, you know, I'd be like,
especially if you can afford Botox, like
yeah,
she
just use
can.
Botox or lasers, and I'll do it.
Yeah.
But yeah, basically, you know, her issue is not really the surgery that she had; it's the laser. Like those CO2 lasers cook you, but she's gonna look awesome. I guarantee you. I'll remember like in
She's
maybe
gonna have a tight neck.
in like a month. I will dig up because she posts on Insta all the time. I'll dig up a picture of her in a month, and I bet that she'll probably do a before and after picture, but I'll dig up some befores and afters of her, and you can see what that CO2 laser does. Like it's pretty nice. Like
If I should follow her on Instagram, and when she posts her picture, I'm gonna be like, your neck looks great.
yeah, dude, her neck got scorched.
I really like your neck.
Yeah, I bet it better look good after like every bit of your skin peeled off of it. But yeah, anyway, I think it's super cool of her to document her journey though. You know, she's not trying to hide anything. If anything, she's educating people about, you know, what some of these procedures recovery is like. So, I mean, I applaud her. I mean,
Yeah,
she got,
if anything, it's just a way to get people to be like, what the heck's going on with you, man?
yeah, right. I mean, she got cooked. It looks like she like
It's
stuck her
making
head in the
people
microwave.
watch her stuff, that's for sure.
Yeah.
So Cindy Hermann actually commented. For one, she said earlier, she said the scallops were amazing. 2 out of the 3 Hermans thoroughly enjoyed them. And then for 2, she also said, yikes, I don't want the CO2 laser and will stick with the halo. That looks awful. My goodness.
Yeah.
Yeah, so.
I wouldn't.
CO2 lasers, I mean, so she's close to 60. So she's actually a really good candidate for CO2 laser. Tamara is, you know, because it's going to make a big difference on her. I mean, she's going to have some downtime for sure. And, you know, like I said, it'll be minimum 2 weeks, maybe a month or longer before her skin's back to normal. But when it does get back to normal, she's going to be looking good.
I honestly can't wait to see what it looks like when
Yeah,
it's normal because
all right.
it's just, it's hard to
I mean,
imagine.
she
it
looks
looking
like
normal.
she was a
Right
burn
now,
victim.
yeah, right now
It
she looks like
it looks like something exploded in her face.
looks like a tire just like went over her. Just like
It's so wild.
We will definitely follow up on her. We got a couple stories we have to follow up
Absolutely.
on this segment. Okay,
Yeah.
all right, Sarah, are you
Oh,
going to
let me get my
educate us
notes.
about
fiber.
fiber?
So-
I have to. I'm ashamed to admit, I don't know a lot about fiber. You know, in my field, it's just not something that comes up a lot. So I'm ready to learn.
Okay, so there's 2 types of fibers. I'm sure you know this. I said one of them earlier.
You did. What was it? I forgot.
Soluble fiber
Oh, soluble.
and insoluble.
Non-soluble or insoluble?
Insoluble. Yeah. So
Okay.
soluble fiber just means it dissolves in water. So that's usually oats, beans, apples, and citrus fruits.
Right. I do remember that. Yes.
Okay, and it helps you regulate blood sugar and lowers cholesterol. And then insoluble fiber does not dissolve in water. It's found
Okay.
in whole grains, nuts, and vegetables.
Right, and
Aids
it's-
digestion.
It's.
And
What
prevents
was the second one? Insoluble?
Yes,
Is that the
insoluble.
better one?
Yeah, it's for it's the one that makes you poop.
Okay.
Like it's good for your
Like bowel. Your
Yeah,
bowel
BMs.
health. Yeah, it's good for your GI health.
keep you regular.
Yeah. I mean, I'm pretty good, but
You know
yes.
all about that.
About being regular?
Just kidding. It's also good for your microbiome, so it acts as a prebiotic.
Okay.
And feeds a beneficial gut bacteria, which helps maintain a healthy microbiome.
Right.
Supports overall health, and it makes your body absorb nutrients better.
Okay. And that's
Yeah.
the insoluble one, right?
Just
Or both of
any
them?
fiber, yeah.
Fiber.
Cody Higgins tapped in. He said it keeps you regular.
Yeah.
Keeps you regular. Okay.
It keeps you regular.
I've heard that. I assume I eat fiber. Like, I don't go out of my way to eat fiber. In fact, I was asking you before we even started the show about the certain foods have fiber in it. Because, I mean, like I said, Fiber is like,
I've never gone out of my way to eat it.
You haven't?
No.
I hear of people like actually taking fiber supplements though.
But I eat a lot of it, not knowing.
Not knowing. Okay.
Not
I assume at
not
some point.
purposefully.
I assume at some point you're going to tell us fiber-rich foods.
Yeah.
Okay. All right.
I told you some of them, but I didn't tell you the
thunder.
most of them.
All right. I want to steal your thunder.
Okay.
Keep
So
going.
we've already
You're
talked
doing
about it's good for digestive
Yes.
health, so it promotes regular BMs. We've already talked about that, and prevents constipation. It's good for weight management because it increases your fullness. So
Okay.
if you
It's like a filling.
so if you need to feel fuller, I would suggest upping fiber,
Upping fiber.
and it won't make you as hungry.
Right. Okay.
Yeah.
That sounds good.
And then heart health, lowers cholesterol levels and reduces heart disease.
And
That's
both of
always
these,
good.
right? It's not just
Yes,
one or the other.
just fiber, yeah, in
Okay.
general. Blood sugar control,
Okay.
it's good for that. And then we've already talked about the microbiome
Right.
support.
It's
of
like a
course.
probiotic.
But it does have some function for immune function, and then it also reduces inflammation.
Nice.
Yeah.
Now, tell me again, is there one of the fibers soluble versus insoluble that's better, or no? You did say one was better, right? Or no? Did I make that up?
I don't think there's foods that are higher in
Insoluble or
fiber.
insoluble?
In fiber.
Okay.
So
it's soluble and
so,
insoluble, it doesn't really matter, right?
So the highest fiber foods are legumes, which are
Right.
lentils, black beans, chickpeas.
I do like chickpeas.
Okay, so those are considered soluble fibers.
Okay. And then insoluble is the grains, right?
No, insoluble is the fruits.
Okay.
Well, it can be oats too, but like insoluble is whole grains.
Whole grains?
Yes.
Okay, whole grains.
Soluble is oats.
Got it. Okay.
I don't really know the difference, honestly.
In oats and...
Oats is like oatmeal,
Yeah.
and then wheat
Right.
is the whole grain.
Got it.
Yeah. Okay. So, so some of the sources of fibers we've already gone over. So fruits, apples, bananas, oranges,
I love
berries,
fruit. I'm a big
and
fruit guy.
pears. Yeah. So I eat apples like weekly.
That's good. Keeps
Daily.
the doctor away,
Yeah.
so they say.
And berries. I love strawberries and all of that. I'm sure a lot of people eat those
Yeah.
regularly. And then vegetables, of course. So what's your favorite vegetable? Do you eat vegetables, Dr. Bruce?
I do. I'm not like, I mean, I do like salads. I do. I eat at least an average
Well,
amount of
lettuce
vegetables.
is not going to have.
Okay. I mean, I like fried okra a lot. Like tomatoes. I like onions.
Okay.
I do like beans.
Okay. Beans is in there.
Yeah, like I like all sorts of beans.
Do you like broccoli?
I do not. I don't like broccoli. I
Carrots?
don't like California. What?
Do you like carrots?
California cauliflower.
Ugh.
Do I like carrots?
Yeah.
I do like carrots if they're cooked. I don't like raw carrots.
What about sweet potatoes?
I'll eat a sweet potato. What about regular potatoes?
Yeah, where potatoes are in there.
So like French fries?
Yeah. Potatoes with skins though.
Potato skins?
Yeah.
One of my faves.
Yeah. Okay, and those are good. Do you like nuts?
I do. I actually eat a fair amount of nuts. I like cashews, almonds.
Okay, almonds is on here. That's the ones with the most fiber. Almonds,
Yeah.
chia seeds, flax seeds, and walnuts.
Sunflower seeds.
Nope, it's not on there. So it probably does have it. It's
Yeah,
just
probably has
not.
some. It's not like
the top.
Yeah, high up there.
Yeah. Yeah. So
and
that's
then
good.
popcorn has some fiber in it, right?
I would think so since it's corn.
Yeah, I didn't know if like when it popped, it like blew all the fiber out. Fiber gone.
It's got fiber, so I guess it busted.
We eat a lot of
It's ready
popcorn
to
in our house.
go.
Huh? We were talking about this earlier. Like, I'm kind of a popcorn connoisseur.
I keep popcorn in my house all day.
Dude, it's the best. The problem is it's like really healthy, but then
When you
the
put
butter
cheese and butter
cheese
on it,
Yeah, right.
It's not.
You put cheese?
Dude, I'm gonna bring you some. I make the best popcorn. It
There's
has,
like little things you can like shake on it.
dude, you guys are gonna laugh. So I buy special popcorn cheese from this like place in Midwest America, and I buy it in 5
I thought you were about
pound
to say
bags.
like Europe.
No, I buy it in 5 pound bags.
Oh my god.
Yeah, and so like we have all the popcorn cheese in the world. They used to sell
Do you
it.
have a theater in your house? A
Well,
movie
we
theater?
just eat it like when we're on the couch hanging out.
Oh, okay.
Yeah, the dogs.
Well, you
circle
should.
around. Yeah.
And then you can invite all your friends
I'm gonna
over
bring you guys some of my.
and have gourmet
In fact, I was just
popcorn.
talking to my wife the other day that I may try to sell this popcorn because it's so good. Like I pop it, I sometimes I'll do it but I have like the popper, like the oil popper.
Oh, that's cool.
Yeah, it's a recipe handed down from like my grandfather to my dad to me.
That's
dope.
nice.
That's really dope.
I'm gonna bring
That's
some for you
cute.
guys.
What would your popcorn company be called?
I had a name for it when I was trying to convince my wife that I was gonna open up a popcorn brand. It was what was it? It was Ernie's Old Time Popcorn, because my dad's name was Ernie.
That's cute.
Yeah, I'm gonna bring you guys. I bet if I bring you guys some, you'd be like, "This is the best popcorn I've ever eaten."
Yeah, I'm gonna have to prove. You have
I'd
to
be
prove
down
that.
to eat
Okay,
it.
all right. I'm gonna make some. All right.
Okay, so
Sorry, Sarah, I derailed you.
no, that's okay. I like popcorn. Okay, so the highest fiber foods, what do you think it is?
It's gonna be well, almonds are pretty high.
Well, what's like the stereotypical?
Grains.
No, beans.
Oh, beans. Okay. I told you I don't know a lot about fiber. Fiber is like a nebulous concept to me. I
So
don't
the
get it.
highest fiber food is lentils. It has
Okay.
15.6 grams.
So like black eyed peas. Is that a bean?
Yeah, I don't know if that's a lentil.
I don't either. I know so little about vegetables.
And then black
It's
beans is
embarrassing.
next.
Oh,
It's
black
at
beans?
15
like
grams.
frijoles?
Yeah, and then
well-
chickpeas is after that.
So that'd be like hummus. I
Yeah,
love
so
hummus.
a woman should be eating 25 grams and a guy should be eating 38 grams. So that gives you about half of your intake if you eat a serving of beans.
When you say, oh, okay, the serving, got it.
Yeah.
Got it.
What do those like fiber bars like rank on the list?
I don't know. That's a good question.
Yeah, like are those real? Like I guess are they really full of fiber or not?
Like you're asking the
Probably-
wrong guy. I barely know what
Those-
fiber is. I mean,
To be honest,
I know a
those-
lot of stuff, but
Those
this is-
nutrition bars are usually just full of sugar.
Facts.
Are
Yeah,
they?
Facts.
Yeah.
So I wonder.
Yeah. But whole grains is next.
Right, whole
and
grains.
then vegetables, obviously. And then nuts and seeds. So I found that I probably do get my daily intake of fiber just by eating the normal stuff I usually eat. Because I do be eating a lot of like berries and stuff. I love blackberries. And I eat a lot of grains
Do you?
too,
I bet you eat pretty healthy
sometimes.
sometimes. When people like work out a lot, I find that either they're like, because you work out a lot.
I do, but I don't eat that healthy.
Okay, so I found there's two sets of people that work out really hard when it comes to eating. Either they work out really hard and they eat really well, or like me,
They're
when I used to
crazies.
work out
They're
hard.
Crazies is what they are.
Huh?
I said they're crazies is what they are.
When I used to work out a lot, I was like, oh, well, I'm like working out. I can go eat chips and salsa and tacos and margaritas because I just worked out and I burned off all these calories.
Exactly.
So, yeah.
I was say, is that not the case? Because that's kind of my mindset like right now.
What?
I work out like probably like 3 to 4 times a week.
Okay.
And then
Yes.
I like kind of like, I don't say I eat what I want, but I eat what I want. Like
Yeah,
after-
right? Because you're working out.
Yeah,
Like,
it's like
Yeah.
you burning calories.
Yeah.
It's all good.
yeah, that's how
That's-
I am too. Those people that like get really, they work out a lot and they're like, oh, I can't eat, a chip because it's got carbs. I'm just like, oh my God.
I would say 50% of the time I'm like looking at what I eat and like consciously making healthy decisions, and
Yeah.
the other 50% I'm not.
I do that, honestly, especially now since I don't work out as much as I used to. Like, I do kind of watch what I eat.
Yeah, I would
Sort of.
think honestly. I mean, I think people eat more fiber than they think they do.
Yeah.
Because I think whenever I think fiber, I just think of beans.
I've said this like
I'm
a
like, I
million
don't know
times.
beans
Like, the
that
American
much.
diet is pretty diverse, and actually, I mean, people like grief the American diet, but like as an American, you don't have to take a lot of supplements because our diet has a little bit of everything in it. And
Yeah, that's another way you can get fiber is you can take a supplement,
yeah,
a fiber supplement.
right, like Metamucil. Isn't that a fiber supplement? Isn't that what like old people take, Metamucil?
I mean,
so.
I
yeah.
think I'm an old person now. I probably should be taking Metamucil.
They mix it in like they drinks, right?
Yeah, right. Yeah, Metamucil.
I've seen the commercials. You know, like when you at
Yeah.
home throughout
It's like
the week. and
it's
you
like
get
old
the-
people playing pickleball and slugging Metamucil.
I'm like, I got pickleball paddles for my birthday.
Have you played it?
I mean, I played it only once, but
I've
I think
never
it's funny
played it.
because you're like old people playing pickleball, and I'm like,
This-
I got.
Dude, some people came by my office. They have like a pickleball like rec center kind of close to where like I live, and
They're putting a new one in Denton that's supposed to be all fancy and stuff.
I wonder if that's the same people that came by. I don't know.
Maybe.
We were thinking
They
about
came
doing.
by to the office. Your office in Denton?
Yeah.
Oh, it's probably them.
I was thinking about doing like a team building pickleball event.
Yeah.
If I do, I'll holler at you. You can come hang out.
I'll be horrible.
Travis, you're invited too. I've never played pickleball. I used to play a lot of racquetball.
I
And
have
I'm pretty
really
good at pickleball.
bad hand-eye coordination.
Oh, really?
Yeah, I'm awful at stuff like that.
Oh, really? Oh, okay.
I'm good at like moving my body, but when
Yeah.
it comes to like me being like, I'm gonna hit that with this
Mm-hmm.
object, no, it doesn't. I don't work like that.
All right, Sarah. Thank you so much for educating me about fiber, because obviously
Oh,
I
you're
don't
welcome.
know hardly anything about fiber.
Tell me all about it next week.
But thank you. I
fiber.
appreciate your segments. They're always excellent. So,
I have to interject a little bit. Cindy Hermann chimed in one more time. She said, Trey and Sarah, y'all are going to love the popcorn. It's legit. And she put 2 exclamation points. So I really believe her after the 2
Okay,
exclamation points.
I will make some. My only complaint about making it for you guys, it's best when it's like
Hot
fresh.
and
Yeah. So
You should make it here.
I might. I mean, I might do that because
Popcorn party.
I could put all my like equipment. I have like equipment, right? It's like a setup. Like I could
A
slug it into a backpack.
Traveling
Cody-
popcorn salesman.
Cody Higgins tapped in one more time.
my
and
goodness.
I'm
Is
assuming
that your
he's
Cody?
talking about Sarah's
Yes.
hand-eye coordination.
Yeah.
Because he said she's really bad.
Thanks, dear.
On the next episode, I'll be talking about fiber, and Sarah will be like trying to hit a baseball that she throws up in the air. It'll be a catastrophe.
Great episode.
All right, you guys. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. Leave us some comments. We want to hear from you. Thanks for all the comments. Take care. We'll see you next week.
Bye.
Bye.